Hey, Tommy, can you hear me? Okay. I can't hear you.
How about now?
Yep, perfect.
Okay.
And
Okay, then.
I can see your PowerPoint too, so
Okay. And then it's doing its thing to.
yeah. And it's set to record. So, yep,
Yeah,
perfect.
I've got it paused and because I've been playing around. But you're seeing the whole screen of the PowerPoint?
I
Okay.
am. Yep. Yep.
Uh, I haven't used Zoom in multiple years because then it went to uh, webcast and then it went to something else. And then, like, we use Teams here and it's like, blah, 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 blah.
Yeah. Yeah. We tried, I prefer Teams, but Zoom makes it easier for the recording for us.
Oh,
So,
sure.
yeah. Now,
Well, I mean,
what
I had
I'll,
no problems with Zoom. It's just kind of like everything else that, well, somebody got the bright idea to change
yeah,
when that
exactly.
was the like Canvas and all that,
Yeah.
then it was uh, went through like three or four different models or versions out there. And then all of a sudden, one company started buying everybody else up, but you couldn't use what you had to use. You had to convert everything to their stuff. And it was just,
Yep. Yep. It's all about the money.
yep, all about the Benjamins.
Yep, that's right. What I'll do is I'll kind of start off the webinar, just kind of tell a little bit about the center, and then I'll go into a brief introduction, and then you're welcome to take off after there.
Okay. Yeah, I sent this
Belinda,
to Belinda to get her to, look at it, critique it, because she had sent me a thing said that she needed to come up with some questions.
yep.
And the uh, part that was on the advertising page, the five or six things she had below it,
Mm-hmm.
are the perfect points
Yep.
to which we're going to talk about those and why they're important, but it
Excellent.
worked out well.
Perfect. We've got a couple people that's joined. We'll get started in just a couple of minutes.
Okay. I'm going to mute myself while you do the introduction, and then that way we don't.
Perfect. For those that just joined, we're going to get started in just a second. I'm expecting a couple more people to join that had signed up, so I'm just going to give them a minute or two to join and then we'll get started. Okay, well, we'll go ahead and get started. And if they join after the fact, we'll get them up to speed. And we will be recording the session, so anyone who wasn't able to join can go back in and view the video. So, good afternoon, everyone, and welcome to today's webinar, Stay Safe, Active Shooter Responses in Hospitals. I'm Dr. Monica Briggs, the Project Director for the Tennessee Center for Nursing Advancement and the sponsor for today's webinar. The Tennessee Center for Nursing Advancement is dedicated to supporting and empowering the nursing workforce across our great state and the Appalachian Highlands. Our mission is rooted in advocacy, education, and collaboration as we work to strengthen the nursing profession, address workforce challenges, and ensure the delivery of quality care for every community in Tennessee. We serve as a resource hub for nurses, healthcare organizations, policymakers, and educators, providing critical insights, tools, and initiatives to tackle current issues and prepare for the future of healthcare, whether it's through workforce research, leadership development programs, or partnerships that bring meaningful change. We are committed to advancing the role and impact of nursing in every corner of our state and the Appalachian Highlands. Today's webinar is a chance for us to connect, learn, and explore how we can continue to make a difference together. Before we dive in and introduce our speaker, let me take a moment to cover a few housekeeping items for today's webinar. All participants, please remain muted during the presentation to minimize distractions. If you experience any technical difficulties, please use the chat box and our team will assist you. We encourage you to ask questions. Feel free to type your questions into the chat box at any time during the presentation, and we'll address them during the designated Q&A session at the end of the webinar. This webinar is being recorded, and a copy of the recording and any shared material will be sent to all registered participants afterwards so that you can revisit the information or share it with colleagues. It will also be posted on the center's website at tcfna.org. All participants will receive a participation certificate via email after the webinar. Also, at the end of the webinar, you'll receive a brief survey. Your feedback is incredibly valuable to us as we continue to improve and deliver meaningful sessions just like this one. Now, with that out of the way, it's my pleasure to introduce today's speaker, Dr. Thomas Cooper. Dr. Thomas Cooper brings extensive frontline experience in emergency, hospitalist, and critical care medicine to his teachings and presentations. Beginning his career in a cardiac intensive care unit, he later found his passion in emergency medicine and has served in both urban trauma centers and rural critical access hospitals. Currently an associate professor at Christian Brothers University in Memphis, Dr. Cooper continues to maintain active clinical practice and presents nationally on emergency preparedness, advanced procedures, and critical response strategies for healthcare settings. Please join me in welcoming Dr. Cooper.
Thank you for that introduction there. A little expansion of that just to make this presentation and why I talk about it and teach about it. Uh, I spent 32 years, I had an active paramedic license. I spent 6.5 years at Grady Hospital in Atlanta, level one trauma center, population of 4 million people. Uh, and I was a special detail. I was assigned occasionally if the Atlanta Police Department SWAT team got dispatched, my unit responded. I was on scene at the Olympic Park bombing in 1996, and EMS transported 225 patients to the hospital in an hour and 42 minutes because we had prepared. That's what this is about. It's how to be prepared and pray it never happens. So we're going to go ahead and get started into it. 1 second when I get my little magic thing here. Okay, these are real facts. These are out of the headline news, uh, the uh, hospital publications, magazines that report everything that goes on. This has evolved over the last 8 months in the United States. A man dies after shooting himself at a Florida hospital. He was told that he had a terminal illness. Uh, he said, well, in his brain, I know it's terminal. I can fix that. Um, And all of these happened in a hospital setting. An employee finds a couple dead in a Texas hospital room. They were husband and wife. One had been very sick for an extended period of time and was in the process of dying. The husband ended the wife's life, and then he took his own life. Police kill an armed patient at Baylor Scott and White Hospital. And if any of you have traveled to the north, east, Baylor Scott and White facilities are everywhere, large facilities, as well as small facilities. The patient had a weapon, a gun. Okay. Well, first off, from my perspective, how did he get in the hospital with a gun? And we'll talk some more about that in a little bit. 5 dead in an Oklahoma hospital campus shooting. The hospital campus uh, was part of the university's campus because it was built on the edge of it. Two dead after shooting in an Ohio hospital. The police, a 94-year-old fatally shoots his wife at a Missouri hospital. Same scenario as above. His wife had a terminal illness and was in the process of dying. He didn't want to see her suffer. And then at a Kaiser Permanente facility, a worker dies by suicide in the hospital. This was an employee. Uh, so things happen. So the prevalence of hospital violence across the country, we think of a hospital as being a safe place. That's where we go if we need help. Okay? Uh, Traditionally, hospitals didn't have to worry about protecting the facility and the people in the hospital from outside problems or even internal violence problems. There was no need for metal detectors. There was no need for security officers with wands like at the airport, those kind of things. But the violent events are continuing and exponentially increasing in numbers. And it's not just one area. I've had this conversation with some politicians. Well, it's in the impoverished areas. No. If you look at the data, the evidence, it occurs everywhere. Impoverished areas, wealthy areas. Um, the employees and the staff now have lost their sense of security and they worry about going to work. Workplace violence is a major problem in healthcare, and the U.S. Bureau of Labor Statistics states that the healthcare workers are 5 times more likely to experience violence than any other occupation in the United States. 93% of assaults are committed against the healthcare workers when these incidents of violence are reported. Earlier this year, the husband of a woman being treated at a hospital in Pennsylvania, y'all may have heard of this because it was all over the national news and including the Memphis news, um, shot and killed a police officer and wounded 5 others. He was upset with the care his terminally ill wife was getting. Um, some of the reports that I've read and been privileged to, she was in a lot of pain, and it's a situation of we can only control so much pain and keep you breathing. Um, I would feel confident that they were doing the best they could to manage her, but to him, they weren't doing enough. Um, these are the kind of instances that happen. The active violence, and when we say active shooter, you hear reports of active shooter. That does not mean that a person has a gun. It is a category of violence that has a response that is the same, whether it's a gun, it's a knife, he's beating up one of the staff members, or she's beating up one of the staff members. It's still will be reported as an active shooter incident. Okay. Uh, the instance of these active violence or active shooter incidents, people get hurt, people die that are innocent. A lot of mental health issues are evolving throughout the country. A lot of PTSD. Those of us that are in healthcare, I, I tell people and I tell students, we all have our demons to live with. We experienced something that was horrendous, um, but we treat ourselves by talking to people, seeking counseling, whatever. The majority of the population doesn't do that. Okay. The incidence of an active shooter instance in the U.S., there were 48 instances in 2023, which was a 60% increase from 2019. And the preliminary data for 2024, there's 68. And they're still checking the records to make sure that they've got properly counting all the incidents. In 2021, now this is 2025, so we're talking about 4 years ago, and we already know that the prevalence is increasing. 11.3 per 10,000 healthcare workers were in a workplace violence situation and received injury. Across the country, it's 4.3 per 10,000 workers. So that's 3 times the average population. Healthcare workers are 2.6 times more likely to be assaulted or threatened. And nurses are the most affected group with a rate of 13.2 assaults per 100 nurses. We just went from 11.3 per 10,000 in the healthcare worker population to a 13.2% in the nursing population. Those are significant numbers. Overall incidence since 2000, there have been 154 hospital-related shooting incidents uh, and that have been documented. Involved 148 hospitals and 235 injuries. 60% of the shootings occur inside the hospital, with the most frequent locations being, and this is additional knowledge that we need, the emergency room, outpatient clinics, parking lots, and patient rooms. If you're working as a nurse in one of these areas, the emergency room, outpatient clinic, on the floor as a med-surg nurse, your situational awareness, which we'll explain, uh, needs to increase because that's where the incidents are occurring. So let's talk about the profile of an active shooter. And again, they don't have to have a gun. It could be active, any type of violence. Uh, an active shooter or an active violence instigator is an individual actively engaged in killing or attempting to kill people in a confined, populated space. In most cases, they do attempt to use a firearm, but there's no pattern or methodology to them selecting their victims. They're going to pick you because you're there, not because they've researched and you did something against them. They're unpredictable situations and they evolve very quickly. Most active shooter situations evolve in less than 45 minutes. Now, when I say evolve, that's from the time of the initial incident till the situation is controlled. The immediate deployment of law enforcement has brought those times down, and their response times have significantly improved. But depending on the situation you're working in, excuse me, I do a lot of work in critical access hospitals. Large county in the Midwest, there's one sheriff's deputy on duty from midnight to 6 a.m. for the entire county. There is no local police department. So if something goes down, there's one person that's going to respond. Others will respond, but they've got to call them from home. They've got to request help from other counties. So the response time is going to be delayed. Okay? When law enforcement arrives, and I have been involved in active shooter responses, law enforcement's job is to eliminate the threat. Period. End discussion. That's what their mission is. Okay. When you prepare for the active shooter situation in the hospital setting, excuse me, a lot of the larger facilities have active shooter plans in place. A thing that you will find out, they don't communicate that to the general staff, which I think personally, from having been involved with it, that everybody needs to at least have the information that we're putting forth here to make yourself aware. Um, to develop an active shooter plan, you have to do a physical survey of the facility. I do them for hospitals, businesses, warehouses is part of my other. That's what the on the beginning slide is that I'm certified um, AVERT instructor. You have to survey the facility that you have and determine what resources are within the facility to protect you or that you can use to protect yourself. Then you've got to develop an overall plan for the entire facility. The security measures, what are they? Are there safe areas, designated safe areas for you to try to get to? And then you've got to train the staff how to respond once the incident starts. There's several programs out. The Homeland Security has one, FBI has one, the AVERT program is one, and there's two or three others. But the FBI's is run, hide, and fight, the three phases of it. All of this, no matter whose program it is, they all involve those three steps. If uh, you're in a situation and you know that there's an active situation going on and it's safe for you to move, you need to go the other way. That's common sense. You're going to find that there are going to be people that freeze in place. As you're trying to run, yes, I'm going to grab you by the arm, but I'm not going to spend 15 minutes trying to talk you into crawling out from under the desk and let's go. I'm going to grab you under the arm. Let's go. We got to go. And I'm done with you because I'm looking out for me. And it's a bad mindset. And as nurses, we're not used to thinking that way. We're used to thinking about the patients, the family members, whatever. Um, Hospitals have unique challenges within themselves because of we have oxygen, 100% oxygen pipes, plumbing running through walls. Uh, you get around an operating room, you have all kinds of flammable gas, flammable liquids, those things that you don't have in other situations. The other thing, if you go through the fire training once you're employed in a hospital, if you have a fire breakout, you're trained and taught to move your patients laterally. Okay. You don't put them on the elevator unless it escalates, but you would move them to the end section of a hallway or another wing in the hospital because they have fireproof doors that will close. And a fireproof door is tested that it will withstand burn through for X amount of time. Okay. So from a fire, you've got some protection when those big doors close. Okay. Depending on the weapon that the perpetrator has, those wooden fire doors may not stop the bullet that they're shooting. So it's a consideration that you have to do. Um, and depending on what department you're working on in the hospital would depend on your strategy for exit or hide. This scene was actually taken outside of a hospital with an active shooter situation in the hospital. Now, you see fire trucks, you see ambulances, you see police department emergency response vehicles over on the left-hand side of the slide. All the people in the dark uniforms are EMS, fire, and law enforcement people. This was in a downtown area up north. I'm not going to say where it was because a lot of the things that happened there were 7 people that died in this particular instance. This was taken by a photojournalist, but it shows you the chaos and it's going on inside as well as outside. So you heard me mention situational awareness. What is it? It's being aware of your surroundings. Uh, Situational awareness is the ability to stay alert and mindful of your surroundings, of the people around you. Identify potential threats before they escalate into danger. You need to incorporate situational awareness in your everyday life. If you work second shift, you get off at 11 o'clock at night or midnight, and on your way home you need gas, or you want to stop at the Quick Trip and get a cup of coffee, okay? Do you just pull up to the gas pump, get out, start pumping your gas? Or do you just pull up in front of the store, get out, and go walking in the door? You shouldn't. You should pay attention to are there 5 people standing by a gas pump and no cars around? Red flag, red alert. Whether they're there just because they met up there or whether they are up to no good. Okay, that's situational awareness. That could be a potential threat. I like to recommend the 20-20-20 rule for situational awareness. It's a good way to identify potential hazards. Every 20 minutes, you take 20 seconds, you look around for 20 feet around you, looking for any hazards or potential hazards. If you identify a hazard, it's got to be evaluated. Okay, the run part. Wherever you go, be aware of alternative exits. If you're in the emergency room and the emergency room is on the ground floor, and there are windows in the room, could the window be an exit? Possibly. Uh, One thing is you want to try to run in the opposite direction away from the attacker. Okay? Don't hesitate. Back to my point a while ago. I'm going to grab your arm and say, let's go. We got to go. We don't have time to wait around because they may change directions and come this way. Okay? If and I've had people say, well, the windows don't let up and down, in the hospital rooms, or they don't open or whatever. It's a piece of glass. There's a chair over here. I can throw through it. There's plenty of stuff around an emergency room or, in a hospital area that we can break the glass out. The things you have to be aware of, though, there again, situational awareness. How far is it to the ground on the other side of the window? Uh, you know, those kind of things. Leave your belongings behind. There's nothing there that either you can't retrieve after the situation is under control or you can't replace. Uh, One of the reasons that you want to leave your things there too is because when law enforcement gets on the scene, you want your hands open like this so they can see there's nothing in them. Uh, Follow all instructions from law enforcement. And as you're exiting and running, don't stop till you are sure 100% that you're in a safe location. This is where we want everybody outside. Um, Unfortunately, realistically, there's going to be some people inside that law enforcement is going to have to secure the situation, eliminate the threat before they'll be able to get out. Hide. Cover and hide if you can evacuate. Find a place that's out of view of the attacker. And then your next goal is to put a solid barrier between you and the attacker. Talked about the fire doors in the hospital. Yes, they're thick. Some of them are 1.5 inches, 2 inches thick of solid wood. That's a good start. You get in a room, close the door, cover up the door with whatever you find in the room to add additional protection. But the problem comes in the walls are usually metal studs and sheetrock. They're not going to stop anything. So you have to be aware of that. Lock and block the doors. If there's blinds on the windows, close the blinds, turn the lights off because you want it dark. Be silent. Turn your phone off. Don't turn it to vibrate. Don't turn the ringer off, turn it to vibrate because you can hear the vibrations. If you have a phone that's working and you are away from the attacker in your secure area, call 911. Let them know where you are exactly, how many of you are there, because that way part of the law enforcement plan will be to know that once they get the threat eliminated or make it safe to extricate you, they'll come lead you out. Now, two big things you've got to understand. We have cover and we have concealment. So what's the difference? Cover provides both protection from bullets and also hides you from view of the assailant. Okay? Two things there. Cover is typically a substantial object. If you are imagining a warehouse situation, there's a forklift. You're on one side of the forklift and the perpetrator's on the other. That is cover. Okay? A concrete wall, the engine area of an automobile, not by the passenger door because you've got two thin pieces of sheet metal to stop a bullet. If I'm up by the wheel and the motor is on the other side of me and the perpetrator's on the other side of there, I do have some cover. Concealment is playing hide and go seek. That's the way to think of it. We're going to get where they can't see us. It may be a bush, like I just talked about the wall construction in the hospital, metal studs that are thin metal, and sheetrock. That's not going to stop a bullet. So cover, an object that provides ballistic protection and can stop or significantly slow down incoming rounds. It's to protect us from both being seen and being shot. And these are some more examples. If you've got a big oak tree trees wider than your shoulders, that's cover. Steel doors, those kind of things. Concealment, it just hides you from the view of others. Okay? There's no protection from bullets. Bushes and trees, sheetrock walls or drywall, glass that's think of it as like stained glass or the opaque glass where it's a color so you can actually see if you stare at it and you can see through it, but if you just walk by it, you're not going to be able to see through it. That won't stop a bullet. Okay? And smoke is concealment. It's not going to stop a bullet, no matter what they do in the movies. So, before we talk about the key takeaways, the one more thing, because I keep talking about law enforcement. I've been there, done that. Their mission when they get on scene is to stop and eliminate the threat. They usually enter in groups of four. If you watch any movies, military movies, or especially if they have a group going in to an area, building, an area, whatever, you have a point person in front. You have a person bringing up the rear. That person bringing up the rear is constantly sweeping around, looking behind where they just came from. The person on point is constantly sweeping around where they're going. And the two members on the between the front and the back are looking at the sides. That's why there's four. Four sides to a box. We want to be protecting ourselves from all sides. When they come in, if someone has been injured or shot, they're going to walk over them. Doesn't matter if there's an arterial bleed that looks like a geyser fountain squirting out. Their mission is to eliminate the threat. If they stop and try to render aid to that person, the perpetrator can cause more chaos and damage. Okay? The EMS people, the medical responders are not going in until law enforcement says that the scene is safe. If, and there again, as nurses, that's counterintuitive to what we're educated and trained to do. Law enforcement will announce themselves. If whether they know that you have sequestered yourself in a room or they're checking to see if anybody's in there, they're going to announce themselves before they open the door. And when they announce themselves, the thing you should do is do this. Hands up, at least head level, palms facing them. Okay? Because understand, everybody is going through an emotional chaos and mental chaos. They are wound up, as my daddy used to say, tight as a banjo string. Okay? We don't want the string breaking. Your goal is to survive, or it should be. So you seek cover over concealment. While it's good to know how to use both, remember that concealment doesn't stop bullets. Okay? If you have to stop initially at a place of concealment, situational awareness, where can I get safely that's going to provide me cover? This is what I was talking about. Okay, they're in a room. These are concrete block walls, if you pay attention to them. This is actually in a classroom. Okay, they've got that big fire door closed, but they've got a table up against it. They've got a bunch of chairs stacked up against it. They've got some desks pushed up there. And if you pay attention in the top right-hand corner of the door, you see a little black box. That's the door hinge. Okay. If the person on the other side tried to come in the room, say you couldn't lock the door, tried to come in the room, they're going to open the door toward them out in the hallway. And these two people that are here on the right have got stuff in their hand, chair. The gentleman on the right, you can see he's holding a chair up because when that door opens and the perpetrator attempts to come through, it's going to get a chair upside the head because this is a last resort. If they don't stop him now, he's in a confined space with them. You only fight as a last resort. Okay. Now, if you look around right now, wherever you're sitting, you'll see a lot of objects around. Situational awareness. What object can you use as a weapon to protect yourself? I did this a week or so ago in a conference room. And the conference room had a big display case on the end wall. And there were these awards and stuff that this business had obtained over the years. There was a silver serving platter, like you see in the big movies. Yeah, big platter. You don't think I'll knock you on the head with that? That's a weapon, okay? Um, Improvised weapons. Use teamwork. Make your plan before that person starts to come through the door. Um, you're fighting for your life. The only fair fight you're going to fight in that situation is one that you win and you're able to walk out. This talks about the mission of law enforcement again. Uh, Follow law enforcement's instructions. Don't start asking them a bunch of questions. Listen to what their instructions are. Now, depending on the law enforcement people responding, in the ideal situation, you're in a large town and they have a SWAT team. When they come in, they're going to be in full combat gear, body armor, the whole thing. If they don't have a SWAT team, they may have on a bulletproof vest, but they're going to be in uniform because they just got called off patrol to come to respond to this. Okay. They may be armed with rifles, shotguns, or their handguns. They may use pepper spray or tear gas to control the situation. I have gone through pepper spray training, which is OC spray. It comes in different strengths. Law enforcement carries 25% concentration. The little things that you can buy at the store to put on your keychain are usually 5%. So significantly stronger. Law enforcement also has some that does not come out as a spray. It comes out as a foam that expands. If they used pepper spray at the other end of the hall, you're going to get some residual irritation from what comes up just in the air. Okay. Uh, Tear gas is the same way. Officers can shout commands. They may push an individual to the ground for their safety. If you could imagine, okay, they have secured the scene. There was a second perpetrator that nobody knew about. And as you're walking down, going out of the building, when the law enforcement people recognizes there's a second perpetrator, they may push you to the ground. It's not to be aggressive, it's to save your life. Okay? There again, follow the officer's commands. Now, the first sentence there, remain calm, is total BS because you're not going to be calm. Your heart's going to be racing. Your brain's going to be going 2,000 miles an hour. You're going to be thinking about your family members at home. Oh my God, I'll never see them again. That's human nature. Okay. If you've got a bag, if you've got a jacket, take the jacket off so that they can see that you're not hiding anything. Don't make quick movements toward the officers. Don't grab them and hold on to them. It's not the time to hug them. Okay. Don't point, scream, yell, and don't ask the officers for help or directions when you're evacuating because they're going to give you the directions. So we survived after the initial threat. How do we treat ourselves? Okay. Well, first, you're going to maintain keeping your hands visible and empty, following the evacuation orders from law enforcement. You're going, at that point, once you're in the safe zone, law enforcement's going to be asking you questions. What did you see? What did you hear? What did you witness? Those kind of things. That's when you provide the information to law enforcement. If you can help the wounded out safely, do that after the scene is secure. And once you get into the safe zone, take your cell phone and call your family because you know that this has been all over TV. The 6 helicopters flying over you if it's in the big city, uh, live video coverage. Let them know that you're okay because once they find out about it, they're having the inverse thoughts that you were having. You were worried about getting home and seeing your family. Your family's at home, worried about seeing you again. And your personal recovery. First off, acknowledge your feelings. Acknowledge that you were scared. Acknowledge that you thought you were going to die or you were afraid you're going to die. Talk about your experience. And we all need someone that we can talk to. But, if you have a family member, if you have, a clergy person, if you have someone to talk to them. It's okay. Talk about your experience. Depending on your emotions and how you're feeling, you might need to seek professional counseling. Uh, don't do TV interviews, don't do radio interviews, don't do newspaper interviews. Uh, Most of y'all don't know who Louis Grizzard was, but he was a Georgia gentleman, came from rural Georgia, wrote a column for the Atlanta Journal-Constitution and did stand-up comedy. And one of his lines in his comedic routine was talking about selling the paper for a quarter. Well, yeah, it's only a quarter. What do you think they print? The news? No. They're going to give the perspective of whoever writes the article, and it may not be an appropriate perspective. Practice self-care. Okay. If you get up at 3 o'clock in the morning every day and take a shower, do that in the morning. Your self-care routine. Well, I'm not going anywhere. I don't have to take a shower. That's not the point. If you don't take care of yourself, you can't get anybody else to do it. Okay? Consider professional help, reach out for immediate support, and get involved in the recovery process for all your coworkers and yourself. Where do you get support? The disaster distress helpline, that's the number. It's an 800 number. Or you can just talk with us to 66746. This is confidential. They have multilingual support. If someone, English is not their primary language, they have interpreters for a multitude of languages, just like the blue phone in the hospital. The SAMHSA's disaster distress helpline, these are trained, licensed counselors with connections all over the country. They can deal with your immediate crisis in that setting, and they can also get follow-up or people in contact with people that can follow up with you. And their line is even available in Spanish. You press 2 once you get them. The American Red Cross. The Red Cross usually provides immediate on-site relief. Okay, if this has been an ongoing situation, you're going to see the little Red Cross van or station wagon or trailer, something over there. People don't think about it. They may be providing drinks for people. Well, that didn't do any good for it. You just came through that scenario and you're not thirsty. It gives you focus. They also can provide mental counseling services. They also can provide financial assistance for things. The Red Cross is a wealth of facilities and capabilities. Okay, I know that was fast. Who has the first question?
So, I have a question. First, this was great. That was very interesting. Um, my question is, at the beginning, you had mentioned about most hospitals have an active shooter plan, but they don't disseminate that necessarily. Are there many hospitals that go through, and I don't even know if it's possible, but do they go through like, drills, like kind of similar to like a fire drill or something like that?
They there's some that do. The majority of the hospitals uh, educate the plan, communicate the plan to their security people. Uh, and I won't talk about my opinion of some of the security people at the hospital, but think about the facility you work in, the security person. Do you want them leading you through this? There's a lot of them, absolutely, follow them anywhere, do whatever they say. But then there's some that you get out your holy water and garlic and run. It's a good question though.
Yeah. And
But
then
you can ask about it.
the other thing, if they're only disseminating the information to the security team, how often are they doing that with turnover the way that it is just in general? I mean, are they getting that plan as soon as they get hired, or is it just a yearly thing that they do? I mean, I can imagine that it falls
They
through the
they
cracks.
should have a yearly drill or a yearly practice, just like you have mass casualty practice and in the emergency room. Um, you have hazmat practice. Um, Several of the larger facilities that I know of will do the upper administration is involved in it. They will do their security people, and then they will do their department heads, uh, which is getting more information out there. But from what I can gather, the ones that I know of, uh, the department managers, department heads' job is to make sure that their department is prepared. Not so much with all disseminating all the information, but making sure that there are escape routes, there are the things in place that if it does happen, that you can, survive it.
I think we had a question on the chat. Karen asked, staff frequently ask for active shooter drills. Do you find that there is resistance from administration?
My professional answer, yes. My personal opinion, answer, those drills cost money. It's non-productive labor cost. Uh, I That is personal opinion, but not all of it, but some of it is. But Homeland Security will put the program on for free. Uh, the course that I do takes between 3 and 4 hours. They're small groups of 15 people, and it's not a big thing. I do a lot of stuff where, like, at the end of your shift, if you're working 8-hour shifts, but you know, it's not rocket science. It's common sense.
Looks like Jennifer had a question. How do we reconcile our inherent need to care for our patients when we run? And then also any suggestions for someone who may freeze?
Well, the goal, if you're just say example, you're med surg nurse, you're on the floor, and you're having an active shooter situation, and you are evacuating. Your job is to take the patients with you, if you can. But you have to think about, okay, this patient's in a hospital bed. You've been taking care of them. Can they walk? Well, you're not going to roll the bed down the hall. And now you might for an ICU patient, because you've got all the bells and whistles and, pumps and vents and all that. But the got a wheelchair? Can we carry them? You know, if we're changing floors, we're not going to get in the elevator, right? Same thing with the fire. We're not going to get in the elevator because you just stepped into the big trap. But what I think, and I do a lot of it at the critical access hospitals that are more than one floor, is teaching the staff how to get patients down the stairwell manually. Uh, it's not that difficult, um, but it takes practice. But all of this stuff costs money to the administration. And then you've got a lot of administrative people that I've talked to because I've had people from a facility, and not just hospitals, but facility asked me to come talk to administration, whatever. Um, and I come talk to them, and well, it's not going to happen here. Really? How you figure that? You got a little globe you look into every morning? But denial is big. But in most potential disaster situations, denial is a key component of leadership thought process for whatever reason. Uh, Somebody that may freeze, as my example, I'm going to grab you by the arm. I'm 6 foot tall and weigh 240 pounds. I'm going to grab your arm. I'm going to have your attention. And if you jerk your arm back and crawl back under the desk, and it sounds awful. It sounds like you don't care. But in that scenario, who is the most important person? Family members that are stuck in rooms. Family members should be able to walk. Okay. If you're secure, if you're securing them in the room, you need to have someone in there that understands the process to explain it to them. The short version. Uh, the goal is to get everybody out of the situational area. Family members should be able to walk. And just as with anything else, if you're taking care of a critically ill patient and their family members there, the best thing you can do as a caregiver is be honest with them. Uh, yes, this is going on. This is what our plan is to get out of here. I'm going to need your help. Incorporate them into the solution. Even if it's, you know, make a stack over there with your purse and, belongings and everything so we'll know where it is and we'll come back and get it. They're doing something. They have a task. Good questions.
Feel free to unmute yourself if you do have a question.
They haven't asked the question that I always get asked.
Oh, what's that?
Have I ever been in these situations? Yes, I have, unfortunately, several times. I've responded as both law enforcement and as medical person.
Hmm.
Um, it's very, I'll call it thought-provoking in the after effect of walking over people that are dying. Because I care for people, I treat people, I make people better. Um, but that's your mission. Uh, and in EMS, you teach early on, first day of your EMT training, you know, what's your initial survey? Is the scene safe? If the perpetrator is still there, the scene is not safe. You're welcome.
Does anyone have any other questions?
Well, thank you for your attentiveness. And if you have any questions or things that come up, Dr. Hitt and uh, Dr. Briggs know how to get in touch with me. I'll be glad you know, to answer by email, whatever. If you have a facility that, church group, whatever, let them know they can get in touch with me and I can try to help you from that aspect.
Great. Thank you all for joining us today for the webinar, and a special thank you to Dr. Cooper. We truly appreciate your time and the time that you took out of your busy schedule and to invest in your personal and professional growth. Your dedication to advancing your career and the nursing profession as a whole is inspiring, and we hope you're leaving today with some valuable insights. Before we wrap up, I do want to remind you that you'll be receiving an email shortly containing your certificate and access to the webinar recording. Additionally, in that email, there will be a short survey, and we would greatly appreciate if you would provide us some feedback. Thank you again for your participation, and we look forward to supporting you as you move forward in your nursing career. I hope everyone has a wonderful day, and thank you, Dr. Cooper, so much. We appreciate it.
Thank you.
All right. Bye-bye, everyone.